Good evening, everyone. I'm Dr. Mohan R, consultant nephrologist and transplant physician working in Davangere, Parvata Life Care. Today, I'll be talking regarding the pedal edema and CKD, its causes, symptoms, and treatment. Today, we'll explore what pedal edema is and its cause, how it related to CKD, and the best way to manage it. Firstly, let's see what pedal edema is. It is a condition where extra fluid accumulates in the lower legs and feet, causing them to swell. This swelling can happen over several years for several reasons, such as heart problem, liver issues, thyroid issues, kidney problems, or blood clots. Our body fluids are divided into two main areas: inside our cells and outside the cell, that is extracellular and intracellular spaces. The outside area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when there is a problem with how fluids are distributed between these areas. This problem can happen if too much pressure builds up in the blood vessels, often due to heart issues or excess fluid. It can also occur if there aren't enough proteins in the blood, like albumin, which helps keep fluid in the vessels. Additionally, the lymphatic system normally helps move extra fluid and protein back into the blood. But if this system isn't working, fluid can build up and cause swelling. The kidneys play a crucial role in regulating the body fluid. The kidney help remove the waste and regulate the fluid. When they are not functioning properly, fluid can accumulate, leading to edema, as seen in CKD or acute kidney injury and nephrotic syndrome. Edema is one of the major syndromes or major symptoms of CKD. Now let's explore how clinicians approach the diagnosis of edema. Firstly, a detailed history helps identify risk factors and underlying conditions such as heart failure or kidney disease and thyroid disorders. This swelling or the edema can be generalized or localized. Generalized edema, this type affects the entire body or large areas and is often linked to conditions such as heart failure or kidney failure. Localized edema, this type causes swelling in just one area of the body. It's often due to inflammation, blocked lymph, or issues with blood flow in the veins. During the examinations, the physical examinations, clinicians look for pitting type of edema where there will be indentation after the pressure, indicating heart failure or nephrotic syndrome. Non-pitting edema suggests lymphatic obstruction or hypothyroidism. In the case of renal disease, the following lab test and image are helpful: complete blood count, renal function test, urine analysis, urine microalbuminuria, and urine albumin to creatinine ratio, as well as an ultrasonography of abdomen and pelvis. A thorough history and physical examinations are key. Identifying systemic cause and specific signs guide the management plan. For local edema, non-pharmacological measures includes limb elevation, compressive therapy, physiotherapy, ice application. In case where systemic causes are at play, such as chronic kidney disease, treatment focus on reducing fluid retention and addressing the underlying condition. This involves salt restriction, diuretics such as loop diuretics, thiazide diuretics, potassium sparing diuretics. The choice and dose of diuretics depends on factors like the severity of edema, the patient hemodynamic status, and the kidney function. It's important to use diuretic cautiously to avoid complications like hypokalemia, hypotension, and electrolyte imbalance. Regular monitoring of fluid volume, urine output, blood pressure, weight, and periodic test is essential. In chronic kidney disease, managing edema often requires salt and fluid restriction and high dose of diuretics. Managing edema involves a tailored approach for local causes. Non-pharmacological methods are key, and systemic causes requires dietary adjustment, diuretics, and close monitoring. Patient education is crucial. Understanding the condition, following the treatment plan, and making lifestyle changes can improve the outcome. Thank you for watching this video. Have a nice day.